5 subtle signs of mini-strokes. Today, I want to start with a question that could be life-saving. Could you recognize a mini-stroke before it's too late? Now you might be thinking, I know what a stroke looks like. But did you know that mini-strokes, or transient ischemic attacks, TIAs, often have subtle signs that are easy to miss? In this video, we'll dive into the concept of these subtle signs. I'll be sharing 5 key indicators that could help you identify a mini-stroke early on. Trust me, this is information you won't want to miss. So why should you care about recognizing the signs of a mini-stroke? First off, if you're over 40 years old, you're at a higher risk for these events. Mini-strokes are more common than you might think and can serve as a warning for a more severe stroke in the future. Missing the signs of a mini-stroke can lead to devastating consequences. These small events can cause long-term damage if left untreated and significantly increase your risk of having a full-blown stroke later on. Early detection and treatment are crucial because they can help prevent major neurological damage and even save your life. Let's get into the nitty-gritty. What exactly is a mini-stroke or TIA? A transient ischemic attack happens when there's a temporary blockage of blood flow to the brain. Unlike full strokes, TIAs don't cause permanent damage, but they are serious warning signs. Mini-strokes differ from full strokes mainly in their duration and severity. While a full stroke causes lasting damage due to prolonged lack of blood flow, a TIA resolves itself within minutes to hours. However, both conditions share similar symptoms. Here are the 5 subtle signs you need to watch out for. Sudden confusion. If you or someone around you suddenly starts having trouble understanding simple conversations or seems unusually disoriented, it could be a sign of a mini-stroke. Brief loss of vision. Experiencing temporary blindness or blurred vision in one or both eyes can indicate an issue with blood flow to the brain. Temporary weakness. Feeling weakness or numbness on one side of your body that comes and goes quickly is another red flag. Speech difficulties. Slurred speech or trouble finding the right words can be indicative of a TIA. Dizziness or loss of balance. Sudden dizziness, loss of balance, or coordination issues are also common symptoms. To make this information more actionable, let's look at how these signs might manifest in everyday life. Consider Jane, a 55-year-old woman who was enjoying her morning coffee while reading the newspaper. Suddenly, she noticed that her vision in her right eye became blurry. She blinked several times, thinking it was just fatigue, but it didn't go away immediately. This brief loss of vision was actually one of those subtle signs we talked about. Now imagine you're having dinner with friends and one of them starts to slur their words or seems confused about what you're discussing. They might laugh it off as tiredness or stress, but it could very well be a mini-stroke happening right before your eyes. If you notice any of these signs in yourself or others, don't ignore them. Here's what you should do. Stay calm. Panicking won't help anyone. Take note. Document when the symptoms started and how long they lasted. Seek immediate medical attention. Even if the symptoms go away quickly, it's crucial to get checked out by a healthcare professional. Educate yourself and others. The more people know about these subtle signs, the better equipped we all are to act quickly. Let's dive into some real-world examples to make this even clearer. Example 1. Sudden confusion. During a conversation. Imagine chatting with your friend Paul at lunch when he suddenly looks puzzled and can't follow what you're saying. He tries to respond, but his words come out jumbled. This sudden confusion could be an indication of a mini-stroke. Example 2. Brief loss of vision while reading. Think about Mary, who loves reading novels before bed. One night, she notices that her vision becomes blurry in her left eye for just a few minutes before returning to normal. This brief loss of vision should not be ignored as it could be signaling a TIA. Example 3. Temporary weakness in one side of the body while walking. Consider John, who's taking his usual evening walk when he suddenly feels his left leg become weak and unsteady for a short period. This temporary weakness might be brushed off as fatigue, but could very well be a sign of a mini-stroke. Let's recap what we've learned today about the 5 subtle signs of mini-strokes. Sudden confusion, brief loss of vision, temporary weakness, speech difficulties, dizziness or loss of balance. Recognizing these signs early on is incredibly important for preventing more serious health issues down the line. Early detection can lead to prompt treatment and potentially save lives. If you found this information valuable, please give this video a thumbs up, share it, and subscribe to our channel for more insightful content. As always, take care of yourself and thanks for watching.